Well, I'll use this model to describe it. So every one of these bones is separated by a dampener. We call these intervertebral discs, and they are made of two parts. We've got both the annular fibrosa, which is like a capsule around the nucleus. And this nucleus, which we call the nucleus pulposa, when it ruptures out of this outer ring, it usually picks up one, in some cases, both nerves. So the pain going down the leg or down the arm, that's going to be usually because of what a lot of people call a slipped disc or a pinched nerve. The question we always ask is, well, what is pinching the nerve? In some cases, it might be something worse like a bone spur, but we can always kind of suss that out and figure out what's going on. So again, that nucleus putting pressure on that nerve is going to cause a lot of pain, and all it takes is the weight of a dime on the nerve to cause dysfunction. And so bowels, bladders, sex organs, legs, all of that's attached to these nerves in the lower back. And when we look at things like in the neck, which is the next most common place to herniate a disc, we're looking at arms and fingers, sometimes some of the glands and organs of the neck, and some even dive down into the chest cavity. So all of this can cause a lot of issues in the long run, whereas in the beginning, the patient may just be feeling pain down an appendage, down their leg or their arm.